It started already? What's up, guys? This is Big Drew. This is Titan Lifestyle. Yes, it's Friday once again. I was out last week, had a little bit of a cold, but I'm back now. I feel great. Shout out to John for hooking me up, too. You know, if you get sick, that's one good thing about being at Titan Medical is they take care of it pretty quickly. But I'm back. This is Titan Lifestyle. I do this every week at 2 p.m. I talk about therapy of the week. I talk about Titan events. And usually I pick out two crazy topics to talk about for you guys today. Crazy one. And also my favorite part, question and answer. So Q&A, get your questions ready. I'll get my answers together as the questions come in. But yeah, let's see who's on real quick. I always want to give some shout outs. We got Nadine, we got Fresh Jumper, we got Allie, that girl. Shout out to Allie, that girl too. I heard about those protein things. I want to check them out real quick. But yeah, we'll see who else is on. We got TikTok, we got Facebook, Instagram, YouTube. So pretty much all over the board. We got Franco Lifts is on here. K Corner's on here. Dodge Lowland, Shay Sparkles. It's Barack's Party. Fitness 973. Elijah Greenwood just joined. Julian Girox. A lot of people on right now. Andrea Maverick. Also, where are you tuning in from? What city, state, or country? If you're from another country, ooh, we got Andrea Maverick. Hello, brother, from Rome in Italy. So first shout out today is going to Andrea Maverick in Italy. So all the way in Italy, they're tuning in, which is big for me because you guys know we only service in the United States. So whenever I see other countries tuning in, it's very, I appreciate it because even though you guys can't get our product shipped to you, you tune in for the knowledge, and, you know, just to watch the show. So that's always good too. So first shout out was in Italy. We're going to jump into therapy of the week. Usually every week I talk about therapy of the week. We have specials here at Titan Medical Center, or we just highlight specific therapies that we have and talk about them, what they do. So if I could have Brian pull up our therapy for the week, and we'll jump into that. A lot of good specials going on too. And if you guys or girls ever need a discount, hit me up directly, and I'll see what I can do. Chances are I'll be able to knock down the price if you go through me only. So, or that you can just call the office 727-389-3220, and you could always let them know that Big Drew sent you and get hooked up. Shout out to my boy Champ NDO. I see you on here right now. Big shout out to NDO. I'll see you out in Vegas. We set something up. We get out to Vegas. You know, we always crank up. But yeah. See who's on. Who else? Howie Strickland, Karma Life. Jay Jahanzi. Sorry with the names. MP3D10. Okay, so let's jump into the therapy of the week. Titan Medical Sexual Stimulant Specials. Now you hear sexually, like, what do you mean sexual stimulant specials? Basically, we have stuff here at Titan Medical that can help you perform better in the bedroom, whether you're male or female. So we have stuff that helps with erectile dysfunction for men. We have stuff that helps with vaginal dryness for women. We have stuff that men and women can take. We have stuff that both of them can take simultaneously. But yeah, so right now, this week, we have multiple Titan Medical Stimulant specials. If you buy 5 Troches, the Lozenges, or you can get 5 Troches or 25% off of one of these therapies. We have the Oxytocin nasal spray. Now, what is Oxytocin? Oxytocin is pretty much going to get you in a good mood. It's going to increase your libido. It's like a mental stimulant. So a lot of times people take Viagra or Cialis to get the blood flow downstairs, but it does nothing for your mind. So what we have here at Titan Medical, Oxytocin nasal spray. So it's a nasal spray sprayed in your nose. It works pretty quickly. It's a little bit more effective than if you were to take a tablet or something like that because it is going right into the nasal membrane, so it'll hit you quick. Injectable PT-141. Now, 141 has the oxytocin in it, and it also has a stimulant for erectile dysfunction in it or vaginal dryness. So pretty much, if a man takes it, he's going to be able to perform better. He's going to have harder, longer erections. If a woman takes it, she's going to be able to perform better. It's going to help with vaginal dryness. So it's basically going to make you, more moist, more wet. So it's going to help as well. So it helps the man, helps the woman. And again, if we have specials, you get 25% off of any of those. And if you buy 5 Troches, those are the lozenges. It's orally. You just take it. It's going to stimulate your mind and downstairs at the same time. So if you get those, you get 25% off of one of the therapies. We also have Sildenafil plus testosterone. What is sildenafil? Sildenafil is the active ingredient in Viagra. Viagra is not the actual ingredient, it's sildenafil. So if you ever see sildenafil, that basically just means it's Viagra. So we have sildenafil plus testosterone. We also have in the troche form, so it's oral. We also have Tadalafil, which is Cialis. So anytime you hear people talk about Cialis or Tadalafil, Tadalafil is the active ingredient in Cialis. So pretty much the same thing. The company is Cialis, the active ingredient is Tadalafil. The company is Viagra, the active ingredient is sildenafil. The easiest way to explain it in a easier way most people can understand is Advil is not the active ingredient, it's ibuprofen, but the company is Advil. So a lot of times people call it Advil even though it's ibuprofen. Tylenol, that's not the active ingredient. The active ingredient is acetaminophen. That's what's in Tylenol. So that's why if you get generic, some of these generic products from these local stores, it's pretty much the same thing as the brand name. So you're paying for the brand name. So back to it, we have Tadalafil, which is the active ingredient for Cialis. We have Ironman, which includes Viagra and Arginine. Arginine, again, is going to help you give you more blood flow, more stimulation with the Viagra. Cupid's candy is Tadalafil, Oxytocin, and PT-141. So that right there is probably in terms of milligrams, you may not get this high of milligrams as a straight Viagra or straight Cialis or sildenafil or Tadalafil. But with the Cupid's candy, what you're going to get is you're going to get the Tadalafil, so it's going to help with the blood flow. You're going to get the Oxytocin, it's going to help with the brain, to get you your libido, and you're going to get the 141. So that's like an all in all, because you want to be able to perform downstairs, but you also want to be in a good mood too. You don't just want to be able to perform and not really be into it. So whether you're a male or a woman, libido is pretty much when you're horny, that's your sex drive. You want that to be up as well. So we have all these therapies. We have all these specials. Call right now. They're going on right now. So you can call 727-389-3220. Take advantage of some of the specials we have. And yeah, let the games begin. I mean, you're going to have fun with these therapies. Now, I wonder if Diddy, that's right, Diddy would have or is using any of the therapies or active ingredients that we have in our therapies in his freak-offs. So yes, P. Diddy, they finally came and arrested him. That's one of our topics today. So perfect timing. I'm going to snowball right into from the PT-141 and the Tadalafil and Oxytocin and all that. We're going to go right into the Diddy sex talk. So it's kind of crazy. They actually picked him up. They actually, arrested him and brought him in. He says Sean Diddy Combs arrests freak-offs at corner of sex trafficking racketeering charges. Now, he has this slew of charges. I'm not really going to get into it. It's been all over the place. But basically, he had a lot of sex parties at his house. He was recording those, and a lot of stuff went on. A lot of mainstream actors, rappers, celebrities, athletes were at these parties. They got video recorded and audio recorded doing sex acts with other celebrities or people that they flew in from out of town and all this stuff. So pretty much, he basically just had a big freaky sex party. Now, the thing with me is everybody saw in the news how he physically assaulted Cassie, that's one of his ex-girlfriends or whatever in the hotel. That's the video that you saw all over the news, where he was basically dragging her through the hallway into the elevator and hit her a couple times. So in terms of that, I definitely see that he should be charged for that. I definitely see, there's no excuse ever to hit a woman. Come on now. It's like we see what you're doing. How are you going to explain that? That I could very well see why they're coming and arresting him and all this. But the other stuff is I really don't understand it. I really don't understand it. It's kind of confusing. Like if they find a whole bunch of tapes at your house of you having these crazy sex parties, how is that illegal? To me, it just seems like you're a freak and you're being nasty and doing stuff. But at the same time, how is that illegal? I know once they dig more into it, we'll find out more information as to exactly why it was illegal. But if you have a whole bunch of consenting adults willingly going to a party and performing these sex acts, whether they're recorded or not, It's illegal to record without people knowing, but I mean, I'm pretty sure these people knew. And then pretty much everybody knows that he knew. All these people that talk about these parties say, yeah, he records you. He, makes sure he could hold that against you in case you do something, he has dirt on you. But again, where's the crime? I don't know where the crime is at. If you record someone not knowing and you show those pictures out to the public, or say if you record someone at your house and then post it, that could be illegal because they didn't give you permission. But if he's not posting anything, if all these videos were recorded at his location, these people know that they're being recorded, and now they're locking, and they found like a safe with all these videos and files. If he hasn't promoted anything or put people's business out there, he just has it for his own whatever, how is that illegal? I mean, how is that? I mean, I'm sure there's plenty of people out there, whether it's with their significant other or whoever, that has, tapes of whatever, that it's illegal. Now we have Eddie Glantz, realtor, said nobody is saying a party is illegal. Yeah, you're right. A party isn't illegal, so it's kind of like, I'm just interested to see what is going to come out of this, what was really illegal. Now, him hitting Cassie, him physically assaulting a woman, we know that's illegal. Him maybe having drugs in the house, him maybe having video of people doing illegal drugs, that's illegal. But I really don't see, it's kind of like, okay, you're a freak, you're nasty, but where's the illegal stuff in it? So I'm really interested to see how this pans out. It's still all new. I'm surprised they actually picked him up. Now, one of his charges is racketeering. Now, I know racketeering, you can get a lot for that. I mean, I know racketeering, I mean, I'm pretty sure, I'm not exactly sure, but I know people have gotten life sentences off of racketeering. Not me personally, but I've heard of it. So the racketeering charges, I believe those will be probably the craziest or most serious charges he has. Now, sex trafficking, if they could prove that he was actually trafficking, that's another serious charge. But again, as of now, all I hear about is a bunch of people going to a party, performing, nasty sexual acts on each other, and they're recorded. So I'm really interested to see how this pans out. How long do you guys think he's actually going to do? How much time you think he's going to get? Is he really going to go to prison for 5, 10, 20 years, or is he going to go for 2 years and then get out and be, in another country somewhere, kind of, sticking to himself? T-Rex says, ain't no party like a Diddy party. Yeah, that's right. It's crazy because everyone used to always talk about these parties, and it was like, yeah, all these interviews over the years, and now it's really coming out. Like, people used to say Diddy parties are crazy, but they didn't really get into detail. Now everybody pretty much knows what that crazy party and stuff is about. Stu Dub said, my guy be jacked. I appreciate you. I'm a patient in Titan Medical Center. Never felt better. Is that Tater? Tater, I appreciate it. I always like to hear when people not only are patients, but how we affected your life. Now, Tater, what brought you to Titan Medical Center? If it's too personal, that's fine. But what brought you to Titan Medical Center, and how do you feel better? You're saying you never felt better. So, say if you were too tired or whatever, or you couldn't sleep, or energy, whatever the case may be. Why'd you come to Titan Medical, and how are you feeling better? And what type of therapies are you using at Titan Medical? Jumping into these questions as I'm doing the topic, because the questions are coming on. You guys know the questions for you guys, my answers for your questions come first. So I'll get back and forth between the topic, but Brian's doing a good job pulling these questions up, so I'm going to get to them as they come. How much is the starting rate for TRT? Thinking about switching clinics, paying $140 per month for TNA. I'm not sure what, TNAI. So I believe that's test, and AI is usually an aromatase inhibitor, something like anastrozole or tamoxifen. Our TRT rates are different here, depending on how much testosterone you get, depending on if you do need an AI, most people do, and also if you take it in clomiphene as well, or HCG as well. So the rates vary here at Titan Medical, and that's basically going to go off of your blood work. So once your blood work comes back, if you do qualify for testosterone, which is TRT, testosterone replacement therapy, one of our medical providers will call you, go over your blood work with you, and if you're low enough, then one of the medical providers is going to give you a prescription for testosterone, whether it's 50, 100, 200 milligrams, depending on what you need. But again, everybody's different. There isn't like a set rate because, again, sometimes people need clomiphene, sometimes people don't want it. Sometimes people only want clomiphene, so just call the line. What is that? Todd. Just call the line 727-389-3220, and just let them know that you're interested in TRT and you want to switch over. Also, I guarantee you're gonna like. I don't even know which clinic you're going to, but I guarantee you're gonna love it here at Titan Medical Center. We do things a little bit different than the other clinics. We don't cut corners. We service all 50 states. We've been in business for over 10 years now, so I'm sure you've done your research on Titan. That's why you're giving us a call, but I appreciate it. Taking 200 milligrams per week, no HCG or clomiphene. 200 milligrams testosterone cypionate or enanthate is pretty much it's a standard dose. Places don't really go higher than that. You kind of get flagged if you do. So that's pretty much the higher end of TRT. You say you're taking no HCG or clomiphene. Is that on your own choice, or is that something that the clinic you went to, they didn't tell you about, or they said you don't need it? It could go off of your blood work, but yeah, 200 per week. That's what I'm prescribed. That's what most people, when they're prescribed testosterone, is what they get. So I've been with Titan for a long, long time now, and I've never been prescribed over 200 milligrams. So it doesn't matter how big I am. It doesn't matter what everything. 200 milligrams is more than enough to bring anybody to optimal levels. So again, it doesn't matter if you get your blood work and your testosterone's 100 or 300 or 500 or whatever. 200 milligrams a week is more than enough. Shout out to Stacy. Stacy's on here. Shout out to Stacy. Stacy, you coming out to Vegas? Will you be in Vegas with us in Vegas? That's right. The Olympia's coming up. 3 weeks, 20 days. I can't wait. Bob, I'm so bad with these names. Bob DeGroot 55 said he's going to get easier size sentence. Yeah. He'll probably have be in his own area. He'll probably have an endless amount of money on his book, so he's going to be able to get snacks and all that. He's probably going to have people bringing him his food, and he may have a cell phone once he's in there and all this stuff. So, I mean, it's not going to be like an average person getting locked up, but again, he's not used to this. I mean, Diddy's been making ridiculous amounts of money for a long time now, so he's going to go from, being in luxury and all this stuff to, one extreme to the other. Oh yeah, she said, "See you there." Yes, see you in Vegas, Stacy. Todd said, prescribe, have kids, not trying to have any kids. That's why I opt out of HCG. Yes, that's very good, important. It's a very good point he just made. He said he's not trying to have any kids. That's why he doesn't do HCG. I see a lot of bodybuilders take HCG, and next thing you know, their wife or girlfriend or someone's pregnant, because HCG will literally make your sperm go from not being existent to super sperm. So it's what they use in reproductive medicine when the man can't have, the man's sperm isn't strong enough to produce children. They use that in reproductive medicine, HCG. Now at Titan Medical, some of our patients are prescribed that with their testosterone, so that way it's not gonna, it helps with testicular atrophy when your testicles constrict, and it also helps you produce real testosterone. So, but again, clomiphene is the route that more people are taking here at Titan Medical because it's a capsule form. You don't have to mix it up. You don't have to inject yourself. It's a lot easier to take, and your estrogen is not elevated so high from the clomiphene as it would be from HCG. Any other questions? See what we got on here. Simply Deep says, I love your observation on a lot of stuff, even though the things I bring up can be unrealistic. Yeah, I try to do the best I can. I'm not a doctor, but I have a ton of knowledge on supplementation, performance enhancing stuff, the nutrition. I've been doing this almost 20 years now, so I do what I can. But again, I'm answering these questions to the best of my ability. A lot of them are stuff that I've done or haven't done or heard about. But again, I'm not a doctor, so I don't want to hear people say, oh, the doctor told me. No, I'm not a doctor. I may have the same knowledge as a doctor, but I'm not a doctor. So by any means. Todd say, do you have to see patients in person or is it telemedicine? If you're in the area, if you're in Tampa area, yes, you could very well come by the office, but we do telemedicine. We service all 50 states except for Idaho. But if you're in Idaho and you have someone in a neighboring state, we could ship to them. They could ship to you as long as the right paperwork is done. That's completely legal. But yeah, We see patients. So basically, say you call the office, tell them you want to be seen, tell them you want to know what we have. They're going to send you to a place closest to your location, whatever city, state you're in, to get your blood work done. Once you get your blood work done, the results will come back to us. The medical provider will call you over Skype or FaceTime. They're going to go over your blood work with you, figure out what's low, what you're lacking, whether your estrogen, your kidney function, hemoglobin, testosterone level. They're going to go over all that with you and then make recommendations based off of your blood work. Now, if testosterone or one of our other therapies is something that you need or qualify for, once it's in the system, then the product will be shipped from a U.S. licensed pharmacy directly to your doorstep in your name. And so it's going to be legally coming to you from a pharmacy. So you don't physically have to come to the office. You don't physically have to go to the pharmacy to pick it up. You could basically just call the number, speak to one of our medical providers or the receptionist on the phone to help set you up with everything. And then once you're in the system and once your blood work comes back to us and once you're good to go, at that point you pretty much just call. Some of the stuff you could order without blood work, some of the stuff you need it, but at that point you just call and say, hey, I want to add this month. I want to add this month. And then you could always call at any time to ask for medical advice about the therapies you're taking or talk to the people in the office. You could text that number as well. So if you're at work, even though people aren't supposed to have their phones at work, sometimes people do. But if you're at work and you have a question, you can send us a text. We'll text back to you, and you could text that number any time, and it's going to be someone texting you back. It's not automated. It's not, you're not going to get a link to get sent. It's actually going to be someone on there texting you back. So you can call that or text that, 727-389-3220, 24/7, 365. Well, actually, the number you can only call to a certain point, 6 p.m., but the texting, you can text whenever you want. How much water do I mix for 10,000 units of HCG? Richard Lifts just asked a question. That depends on how much HCG you're doing, depends on how much you're prescribed. Now, if the vial is 10,000 units of HCG, you need to do a calculation. If you put 2 mLs of water in there, you need to figure out how much microgram or milligram and all is different. So if I were to look at your prescription and it says you need to take this amount, I could do the math on it. But again, everyone's different. So how much water you put into 10,000 HCG might be different than someone else, because each time you do your injections, you might do, on the ticker, on the needle, you might do to 0.2, the next guy might do to 0.4, so depending on the water. So, I mean, that's like a whole math equation. It's completely different for everybody. So it's not a standard amount because it's not a standard, everyone's different. Someone said something about sub-Q, if you go up a little bit. Richard, for sub-Q every day, again, everyone's different, but I don't do sub-Q HCG. Everything I do is IM. I don't do sub-Q anything. I hate sub-Q. It works for some people. It doesn't work for me. I don't have any body fat on my stomach really or my abs, so if I were to try to do something like that, I feel like it's not absorbing. I don't know. I IM everything. So 10 on the insulin needle every day. Yeah, again, that's different. I don't know if you mean 0.1 or 10. I can't say. Pretty much just call the office, 727-389-3220, and just let them know how to constitute it. And again, if you're asking me a question of how to constitute your HCG, I'm assuming you're not taking a prescription, because through Titan Medical Center, when we send you your HCG, it's going to come in like, the prescription bottle. It's going to say on the bottle your name, all your information, so it's specific to you. And it's going to say on the bottle how much water to add for the vial specific to you. So again, that's even more reason to go through a medical provider, because you don't really have to guess and ask people. You can just go what they tell you. But I know here at Titan, all of our vials or all of our prescription bottles are going to tell you how much to use specific to the individual. My brother should be a horse. Was the meeting before GNC? He did too much, they decided. I have no idea what that means. Anyways, 4 more pounds than he did in high school today. It's good that he's gained the weight. I really don't know where you're going with this, but yeah, if you're trying to gain some weight, it's good. I managed to gain weight, but not like it's healthy. Yeah, you want to gain, depending on how old you are, and the reason why I say that, because when I was younger, I used to just eat fast food and everything and just try to get as big as I could. Now, hell no. But Yeah, that's one thing that separates certain people from other people. You can gain weight. Anybody can gain weight, but if you can gain quality weight, that's what sets you apart. So it's kind of like, I'm a bigger guy, but I would assume, or what I hear, what sets me apart is me having a low body fat with a small waist. If I had a big waist and high body fat, there's plenty of guys walking around my height and my weight. So I take pride in having the weight be a little bit more quality. So when I take off my shirt, you don't really see any body fat. It looks like it's something I worked hard for. So, but if you want to gain the weight, you got to gain the healthy weight, man. It just takes a little bit longer. You may have to eat. It might take a little longer. You could pound the fast food 3-4 times a day, eat a pint of Ben & Jerry's every single night, like I used to do, not anymore, to gain the weight. But then, you're gaining water and fat to gain just a little bit of muscle. Why not just gain quality muscle tissue, eat good, healthy food, eat a lot of it, and just take a little bit longer to get there, as opposed to, pounding the calories and sodium and cheese and burgers and pizza and creatine, mass loads, and it's not good. So healthy weight's always the best way to go, but people do get impatient. So opinions on peptides in conjunction with TRT, DJC 109. I think it's a great idea. Depends what peptides you're using. Everybody uses peptides for different reasons. But yeah, I would definitely say it's a good idea. Right now, what I'm doing for peptides wise, I'm doing BPC 157, I'm doing CJC 1295, and I'm also doing TB 500. So I'm doing all three right now. I'm feeling great. I just started these three. It's been about a week or two now. I started back on my healing peptides, I should say. My elbows were getting kind of crazy from the heavy lifting, so I'm excited. By the time I get to Olympia, all this stuff's going to be kicking in. My elbows are going to feel great. Hopefully get some good heavy workouts out there. But yeah, it just depends what you want. We have stuff to help your connective tissue, your ligaments. We have stuff that helps you sleep. Ladies, we have stuff for your hair, skin, nails. Again, like I spoke to earlier, with some of our therapies of the week, we have stuff that helps with sexual stimulation. We have stuff that helps with blood pressure. We have stuff that helps with edema. We have stuff that helps with your mood, to help you keep you in a good mood. We have stuff for mental focus. We have stuff to give you a pump in the gym. We have stuff to give you energy in the gym. There's so much stuff we have. But again, if you're not sure if you could take it with TRT, when you call the office, just let them know, I watched the show, Drew was talking about this. Can I take this with TRT? They'll tell you right away if you can take it with TRT or not. Most of the stuff you can. But every once in a while, there'll be something where it's like, we can't do that if this, Like, for instance, you don't want to take MK67 with IGF-1 because it's gonna cause too much of an overload in IGF, because they both release IGF. So once again, certain things you can, certain things you can't. It's always good to just ask. 157. What I was curious about was what I was curious about. BPC 157. It's a healing peptide. It's good for your helps rejuvenate the connective tissue and ligaments within the joint if you have any pain. Another thing good with BP 157, it also helps with GERD, acid reflux, or severe hiccups. So if you guys, girls, get chronic hiccups or get heartburn every time you eat red sauce or something lemon or citrusy, BPC 157 can actually help with that. And we do have that in an oral form, which is going to help even more so with that. So a lot of people take it for other reasons. I actually started because of that. I have a sensitive stomach, so sometimes if I eat too much, red sauce or oranges I get heartburn. So I started taking the BP 157 specifically for that, and so far so good. Weed Todd says Deca 150 milligrams per week helped my joints very, very fast. It may have took the pain away from your joints, but it definitely did not help your joints. What Deca does, also known as Nandrolone. Nandrolone is the active ingredient within Deca. What Deca does is it's going to lubricate your joints. So basically, like the Tin Man on The Wizard of Oz, he has squeaky elbows. You put the oil in there, it's not squeaking no more. That didn't necessarily fix the problem. All that did is numb it up so you don't feel what's happening. So whatever type of grinding or damaging on your cartilage or connective tissues or your elbow, knees, whatever it was, is still there. All you're doing is just covering it up with water so you don't feel it. kind of like masking the pain. Now, what we have at Titan Medical Center, TB500, for instance, that's actually going to rejuvenate and repair the connective tissue. So yes, the pain is gone, but the injury is gone. DECA doesn't help with injuries. All it does is help with pain. So what happens is a lot of old school guys take DECA. Oh, my elbow's DECA. They take DECA, and what happens is as soon as the DECA starts wearing off, they have that pain again. That means it never really went away. So what do? They take more DECA. And they have to keep taking DECA and keep taking DECA. Now, one thing with DECA is it's known as DECA dick, where if you take DECA for too long and your test is low, now you have erectile dysfunction because your prolactin has gone too high. So DECA can have a slew of other stuff too. So yeah, it's great your elbows and knees don't hurt anymore, temporarily, but now you have other issues. So, I mean, you're not masking, you're not fixing the problem, you're just masking the problem. So I always like to tell people that when they take DECA. And again, Todd said he runs 200 tests, 150 DECA a week, and he feels great, and his estrogen is in good range. Again, DECA is not going to do anything to your estrogen. It's going to increase your prolactin. So actually, old school bodybuilders take DECA for a long time. They can literally squeeze their nipple and lactate because of progesterone. So you need, your estrogen, on paper, your estrogen might be good, but your prolactin might be through the roof. So that's why a lot of guys, they take extra anastrozole while they're on DECA thinking it's going to fix it, and it's actually worse because anastrozole dries you out and DECA puts water into the joint. So you're really going all over the place. So not a fan of DECA. I'm not going to lie. I took it once, maybe 10 years ago, and I didn't like it at all. I felt weird on it. I felt like it was smoothing my body out, like I was losing my definition. I didn't like it at all, at all. And not only that, DECA stays in your system up 10 to 11 months off of a single injection. There was a kid in high school, top football player, that had an injury on his knee. He went to the doctor with his mom because he was still a minor. The doctor's like, we'll give him a shot for the pain. They gave him a shot of nandrolone, which is DECA. Next thing you know, a year later, he's going to NCAA to play football. He failed the drug test for nandrolone. It was still in his system because his mom or him, they didn't really ask questions. What are you giving me? He just, I need something for the pain. And he got something for the pain. So that's another thing, too. So I'm not a fan of DECA at all. Todd said he's seen some dudes lactate from Tren. Absolutely crazy. Yes, Tren and DECA the same way. Also equipoise. Not a fan of all these illegal substances. There's no doctors that will prescribe trenbolone, so stay away from it. You're talking about trenbolone, which is a veterinary steroid. It's not even intended for humans. And EQ, which is equipoise, which is another veterinary steroid that was intended for dogs and cats and horses. So not a good thing. We have plenty of other things at Titan Medical that are intended for humans, that are healthy for humans, that we could regulate, keep you healthy. Any other questions? Got a lot of good questions on here today. A lot of good questions today. Let me see. Yeah, but this Diddy stuff's crazy. Let me jump back in this Diddy thing real quick. Some of the stuff, some of his charges that they've had so far. It says bags of pink powder were found in Sean Combs' hotel room after he flew to New York. So the drugs I could see. I mean, obviously, if you have a house full of illegal drugs, obviously there's going to be something that comes with that. Yeah, it says a lot of this stuff is almost like he just got caught cheating and got caught being nasty, but I'm trying to figure out where the actual trafficking comes into place. Because it says right now, this is evidence not of sex trafficking, but of being caught being unfaithful. That's from defense lawyer Mark Angelafilo, told the court arguing for his client to be granted bail. Judge denied bail, so he doesn't have any bail. Yeah, so pretty much, I mean, he pretty much screwed. I mean, yeah, these are all just basically some lawyers talking about the case and what exactly is going to happen. So pretty much right now, music mogul Sean Diddy Combs was arrested late last night in a New York City hotel, has been charged with racketeering, sex trafficking, and transportation of engaged transportation to engage in prostitution. So basically, transportation to engage in prostitution basically means that he flew people in, whether they're the people having sex with the other people or he flew people in to have sex with people. So in other words, I'm going to fly in this porn star to my party so she could have sex with groups of people. That was one of the things I heard the other day. So I guess that's a crime, your transportation to engage in prostitution. Now, obviously, if money's involved, if he's paying these women or these men to do these things, then obviously that's when the prostitution comes involved. Said in the hearing in Manhattan, Combs pleaded not guilty, but he was denied bail and will remain in custody. It says the charges are tied to freak-offs, coerced sex acts that Combs allegedly orchestrated and recorded according to federal indictment. So basically, yeah, these big basically sex parties that he recorded. A bail appeal hearing has been set for this week. And Combs has faced a wave of lawsuits, one as recent as last week, accusing him of sexual assault and misconduct in the past year. And he was also, he has denied any wrongdoing. So basically, he's denied everything. He said he hasn't done anything wrong. I don't know how he's going to deny the video of him hitting Cassie in the hotel because we could see what you're doing. But yeah, he's basically screwed. JE_SS7320. What's up, Drew? What's the best oral TRT you recommend? Troches or enclomiphene? I would say both if you can. Again, I don't even know if I'm assuming you can, just because if I'm prescribed testosterone, I'm getting enclomiphene, so I'm not sure why you couldn't get the Troches testosterone and enclomiphene. But I would say both. Again, injectable is always the best, strongest, most effective way for your TRT. But if you want to go the oral route, that too, I'd say both. Johnny 5, I think we came up with a good one for that around He's Not Diddy Anymore, the Diddler. I like that. Johnny 5, the Diddler. That's good. I'm going to use that. I'm going to steal that, Johnny 5, the Diddler. I'm going to give you a shout out on my next live. And put that on there, Johnny 5, the Diddler. Yeah, I like that one. DJC 109, no shows for me. I always messed up my diet. Could never get lower than 12 to 15% body fat. Yep, not dieting hard enough then. Or not hard enough or not long enough. Todd said, it's painful being show ready, lean. I was weak and joints hurt extremely bad. Yeah, that's how I get. My joints do hurt a little bit because I stay lean. I'm always under 10%. So I'm always, my elbows are real lean. I've like skinny joints, so my elbows are real lean and dry. But yeah, hopefully this BPC and everything kicks in. Last time I took it, it kicked in pretty good. But then I started lifting heavy again, going crazy, and I'm like, man, I got to chill. So that's one thing, too, is you want to repair the connective tissue and ligament before you start lifting heavy. So in other words, if you're like, yeah, I want to start lifting heavy again, grab some BPC, some TB500, start taking it for a couple months, repair the ligament, get the connective tissue, everything strong, get the joint healed, ready to go, then lift heavy. Don't lift heavy first, oh, my elbows hurt, and then try to fix it. It's kind of like having a car. You don't wait till you smell a burning smell and see the gas light on and have all these lights on your dashboard saying change your oil. You change your oil every 3,000 or whatever miles to same thing with your body. You want to put the oil, basically put the BPC in your body first to fix your ligaments and joints before you lift heavy. So that's another thing you can do too. So you want to get stronger. Your muscles want to get stronger as your ligaments are getting stronger. That's how you're going to avoid injury. That's how you're going to avoid pain. Slow and steady always wins the race. Basic ass Trey says, I like the name. Man, I'm waiting on my blood work right now to start test C. Yes, test Cipinate. Also, big shout out that you're actually doing your blood work before you start your test. Todd, what do you think about Mike Mentzer's style of training? I love it. Mike Mentzer's style of training will probably be the best way someone could train if they're experiencing these elbow and ligament and tendon problems, because he takes such long rest periods. I mean, I know Mike, he used to train biceps like every 10 days or something like that and still get growth out of it. So I'm addicted to the gym. It's hard for me to take that much time off, but I really think Mike Mentzer he was on to something with his training philosophies. How long does it take to grow your tendons? Depends how much damage you have, and depends what you're doing. How much BPC or TB500 are you doing? How much damage is there? It's basically, it's not really growing the tendon. I guess it is, but it's kind of just fixing it. So in other words, your tendon isn't going to be bigger than it used to be. It's just going to get it back to its normal function. You think Diddy is going to drop names? Absolutely. Absolutely. I mean, he's got so many names. Why wouldn't he? I mean, think about it. They're like, oh, well, but the thing is, in his situation, it might not even make a difference even if he does drop names because they have so much on him. It's not like, oh, just tell us the person and okay, then now you're free. There's so much. So, I mean, not only that, too, is usually when you're, not usually, but when I see situations like this happen, legal situations where people have charging or accusing, usually the person that is committing or being accused of committing the crimes has millions of dollars or billions, and then the people that are accusing him don't really have a lot of money. In this situation, these freak-offs and these parties, I mean, these are other celebrities, other rappers, other athletes, other, company owners and people with a lot of money that are there. So these people have money too. So they're going to have money to get a good lawyer to say, no, he did do this. So it's not just, Diddy has all the money in the world. Some random person who doesn't have that much money is accusing him. He's like, yeah, whatever, here, take some money, I can pay you off. You're not going to be able to pay these people off because these people already have the money, a lot of them. So that's another thing too. You can't just, that's another reason why. I'm sure he'll give names, but we'll just see how long it takes before anything happens. Basic ass Trey said, when I start test C, how long does it take to see results? Should I start heavy or do more reps first? Now, in terms of seeing results in the mirror, if you've never taken testosterone cypionate before, you're probably going to start noticing like muscle fullness and in the mirror, maybe 3 weeks, 4 weeks, maybe. But in terms of mentally, I'd probably say maybe like less than a week or even like a week to 10 days. Like you're going to feel it mentally. You're going to feel like in a better, you're going to feel like you're on something. Your libido is going to go up. You're going to be in a better mood. Your recovery is going to be good. So now in terms of, you're asking me about training style, should you start heavy or do more reps? I wouldn't start heavy because what's going to happen is the testosterone cypionate is going to make you stronger. So if you start too heavy, like I said before, you might get strong too fast for your elbows and ligaments to catch up. So again, I would slowly ease your way into it. Just because you can lift so heavy, don't lift heavy in the beginning. Just do a little bit more reps with your normal heavy rate. So say if you're bench pressing, 200 pounds 10 times. Okay, when you're taking testosterone, don't go to 250, just do 215 times. Do that for a while before you get everything ready. And then one day, a month or two down the line, then you can be like, I'm going to try to go up a little bit. When you go up a little bit too fast, that's when stuff pops. That's when you have other problems. Hence why Mike Menster's style of training was so good, because he would take so much time off. When you take time off from the gym, it's not so much so the ligament can heal. It's also to give you body recovery so you can push the weight. You're not going to max bench press 2-3 times a week. You're going to have to train for it, take a week off, and then go in. So everyone's different. Do you think Hadi Chupin will throw a fit for placing second like he did last Olympia? I don't know. I don't really think he threw a fit. It was kind of, I have mixed reviews on it. It's kind of, I don't know if it's disrespectful or just walk off, but it wasn't like he said anything. It wasn't like he threw his hands in the air. It wasn't like, I think he even shook Derek's hand as he was leaving. So it wasn't like he showed his respect. It was just like, okay, you got to stand up there a little bit. You can't just leave like that. So I don't think he threw a fit. I think it was wrong that he left. I don't know if he'll throw a fit this time, because last time people probably told him, look, you can't do that. So probably like now he's probably like, okay, like he's probably more aware of it now. But again, I don't know. Derek's looking crazy. Derek is looking crazy. I see him in the gym. He trains at my gym. Yeah, he's looking absolutely nuts. His back is looking crazy. His vacuum's always on point, so these guys better bring it. I know Samson looks good right now. Nick always looks good. Andrew looks good, so we'll see. It's going to be interesting. Again, that's in 3 weeks now. Titan Medical will be there. Let's jump into these events real quick. Titan Medical will be at the Olympia. The booth this year is huge. The reason why I know it's huge is because John specifically told me it's huge. And not only that, I know it's big because, every year, we get out there, the team helps set up the booth and all this stuff. John said I had to hire a special team just to set up this booth. So he has like a booth crew just to set up this booth. So it's gonna be. I can't wait to see what it looks like. I'm excited. It's like 20 days away. It's in Vegas. The new venue is supposed to be real nice. It's at the Resort World in Las Vegas. The expo is at a different place than the actual show, so make sure if you're coming, make sure you get everything coordinated to figure out when stuff is. But yeah, it's gonna be fun. That's 10/10 to 10/13, so it's coming up real quick. The week after that, I'll be out in St. Pete, Florida for the Hurricane Pro. Shout out to Tim Gardner. It's a 2-day show this year, 10/18, 10/19. Also a great show, sponsored by Titan Medical. You'll see our booth. As soon as you walk in, you're going to see a big Titan booth right there at the Coliseum in St. Pete. And then after that, Cars and Couture. Cars and Couture is 11/16. I believe that's like the week before Thanksgiving. I'm not sure. It might be. But it's 11/16, Cars and Couture. Huge car show. Bugattis, McLarens, Lamborghinis, Ferraris, a whole bunch of Hellcats, old school muscle cars, new tricked out Tesla trucks. I mean, pretty much everything's going to be at Cars and Couture. And again, that's 11/16. So that's the last event that we have as of right now. Check the website. Tune in every week. If we have any new events coming out, we'll let you know about that. Also, some of the events that we don't have, they're not necessarily events, but we send these girls out to different gyms to pass out free T-shirts and talk about Titan Medical Center. So if I get any information from Destiny as to when the girls are going to be out there, because someone asked me, when's the next time Titan's going to be at one of these gyms? So whether it's, Crunch Channel side or EOS, whatever it is, I'll let you guys know as soon as I know, as soon as Destiny lets me know when the girls are going to be out there, so you guys can come by, see the girls, get some free Titan gear. Big Ass Trey said, I'm starting out with a blank canvas, 5'11", 230, but losing weight. 5'11", 230 is good weight. It's a good height and weight. It's just a matter of how that weight looks. But again, do it the right way, do it the slow, steady way, and be consistent. Find foods that digest good for your body, too. If your boy does chicken, that doesn't mean you need chicken. Find foods you could eat that are gentle enough to just keep passing through. Esquire Broker says, hi, Big Drew. What's up, Esquire Broker? What's the best hormone for losing belly fat? Jack Covington III. Best hormone for losing belly fat? I'm not sure if hormone, but I know testosterone. It's a new product we have here at Titan Medical. Works kind of like IGF, lean muscle tissue, helps with cell volumization within the muscle. And I know with testosterone, it actually targets specific belly fat. So that's one of the things that literally targets belly fat. So I would say testosterone, obviously combined with a good diet, HRT a little bit too, but testosterone will definitely help with targeting your belly fat. David D says, how does Titan Medical Center address anti-aging concerns through its therapies? We have a lot of different anti-aging therapies or therapies that help with anti-aging. That question is too broad. It would take me like 5 shows to go through because everyone's different. But again, we have plenty of anti-aging stuff. Just call the line, let them know what you're interested in, and they can let us know because everyone's different. Anti-aging for someone who's 40 will be different for someone who's 55 or 25, so. Cabrina Blowski says, how does Titan Medical Center personalize IV therapy for individual patient needs? Good question. Basically, you can come to the office, you can get an IV, basically an intravenous bag of, we like to call it our IV drips. Now, what we can do specifically for those patients, if you want glutathione in there, if you want, NAD, if you want even Hercules. You can pretty much put anything within that bag. So you basically just call the office, tell them you like an IV bag, ask what they offer, but you could also customize your own bag. You could be like, I want glutathione, I want vitamin this, I want this, I want this. And literally, my bag, when me and John get our bags, the bag looks like Gatorade. It's like orange because it has like so much vitamins and antioxidant stuff in there. So let them know what you want in your bag, and we could basically put it into your bag for you and customize it for you. Tanisha was good. I haven't seen Tanisha in a while. Tanisha, you're going to be at the Olympia. Keep asking people. I want everybody to come out to Vegas. It's going to be crazy. Todd said, is Nick even competing at the Olympia, or is he just doing the Arnold? I'm actually not sure. That's a good question, because I see Nick's always on point. He's always dieting. He's always doing his cardio. He always looks good. So I'm not really sure what he's doing. I saw a video of him the other day, and he looked like he was leaning out in shape, but then again, I'm not sure. I mean, I'm just assuming that he'll be doing the Olympia, but again, I don't know. That's a good question. I have to look into that when I get off. Slim Fit Ash, how do Titan Medical Center's therapies target specific areas of fat loss, such as abdominal fat? Once again, testosterone, I just spoke about it with David. I think it was David or someone else just asked about that. But testosterone specifically targets abdominal fat. And we also have fat-burning creams that you could rub, topical cream that you could rub on the area. It's going to help tighten up your skin and burn fat as well. So if you're looking for like a double, you can get testosterone with the fat-burning cream and also combine that with a healthy diet, and then combine that with a little bit of working out, and then you're good to go. We're getting a little bit towards the end of the show. I got to wrap it up real soon. They only give me an hour here. Otherwise, I'll get bumped off. Tanisha, I'm trying my best. My 42nd birthday is tomorrow. Well, happy birthday. Happy birthday, Tanisha, 42. Thanks for Goddess. Appreciate you. I appreciate you as well. Does test reduce perception of chronic back pain? The perception of chronic back pain or chronic back pain? I mean, I'm not really sure how that would reduce or change anything to your back pain. If your lower back pain is not back, if it's kidney related, that could be a whole nother thing. A lot of times people say, I have back pain, but it's really their kidneys. Your kidneys are on your lower back. So if you have pain, you might need to drink more water, fix that out. Urs popped out. He's way bigger than this year than last year. Yeah, Urs is huge. He needs to go to Open. Urs is a classic bodybuilder, and he's like huge, but he's like classic. I mean, he's like my size doing classic physique, and there's no way I could lean down to get that low like that. So it's kind of crazy. He looks good though. I think he should do Open. Love from Texas. Appreciate it. Yeah, that's pretty much it today. They're asking about the perception of back pain, and they said like how much you feel it. That's different person to person. What the back pain's coming from. Is it an injury? Is it muscle soreness? That could be a huge thing. But I do not think that TRT is going to reduce or increase back pain at all. I've never heard of that. Usually that's something, another issue. That's pretty much it for today. I don't see any more questions. I talked about therapy of the week. Make sure you guys check out these Titan events, the Olympia, the Hurricane Pro, and also Cars and Couture. If you're on YouTube, hit the bell so you're notified of videos just like this. You could also check me out on TikTok, Facebook, and also Instagram as well. This is Titan Medical. I'm Big Drew. Be safe, and I will see you next week.